This is the strategic audit project of Amy Kellett, and I am just realizing my papers are in different order. There we go. This strategic audit of an organization includes investigation of multiple factors that provide a complete overall picture of the organizational structure inside and out. The analysis of external and internal factor evaluation of the current situation and a study of the corporate governance are all considered within the formation of variables affecting strategic planning. This overall analysis is then used to formulate strategic opportunities for the organization in terms of growth, program development, and/or stability, while maintaining a focus on intervention in response to demands of the economy, political factors, and the general population. The use of the SWOT analysis within an external environmental scan includes examining the opportunities and threats of uncontrollable external factors that develop throughout society, within the industry, and by competitors. External opportunities present competitive advantages if they are acted upon, whereas threats can destroy an organization if not defended against. Political factors affecting the external environment of the hospital include that of new regulations such as the Affordable Care Act. With its implementation, the number of individuals seeking health care has and will continue to increase over time. According to the Kaiser Family Foundation, the United States saw a 3% decrease in the uninsured from 2013 to 2014, and specifically in Ohio, the number of uninsured individuals dropped 5% in that same single year. The increased life expectancy of our population is another external factor to be considered, as specialized healthcare needs associated with living longer will increase. One population of higher concern is that of individuals who were born with a congenital heart defect and the increase in their lifespan. Although the incidence of being born with a congenital heart defect is consistent, their survival rates into adulthood have increased exponentially. A force from within the natural physical environment currently affecting the population is that of pediatric obesity. According to the Ohio's Children Healthy Ohio program in 2009, Ohio ranks 15th highest in the nation in obesity rates. Approximately 19% of Ohio third grade children are overweight and 17% of them are obese. Another external environmental factor to consider is competition of pediatric health care. As there are currently 8 pediatric hospitals within the state of Ohio, all with good heart programs, just like the Heart Center, making it difficult to expand the service area to capture the cardiac health care needs of populations outside the primary radius of the main campus. The thorough strategic audit of this corporation also includes performing an internal environmental scan that focuses on the strengths and weaknesses of the operation in an effort to take advantage of and develop resource opportunities while at the same time avoid its threats. Included in this scan is an evaluation of the organization's current situation and gathering of cumulative data that provide a view of the organizational performance over the past year. Nationwide Children's Hospital is a not-for-profit healthcare organization that is creating the future of pediatric healthcare. NCH is recently named America's largest pediatric healthcare and research center, serving more than 1 million patients' visits each year. The mission of Nationwide Children's Hospital is simply yet precisely stated. Nationwide Children's believes that no child should be refused necessary care and attention for the lack of the ability to pay. Departmentally, the Heart Center stands strong with the above corporate goals, along with their motto of Out in Front, by researching and discovering causes of heart defects and uncovering new techniques and therapies that better the future outcomes for all patients. The Heart Center services are plentiful and include the cardiology clinic, non-invasive cardiology, cardiothoracic surgery, inpatient and cardiac intensive care units, electrophysiology services, which are heart rhythm related, adult congenital disease management, and preventative cardiology clinics, to name a small few. These services are provided within the main campus and all over the state of Ohio from Athens to Zanesville with outreach clinic programs. In addition, the Heart Center has entered into a partnership with Dayton Children's Hospital as well as Rainbow Babies Children's Hospital for collaborative heart care. The corporate governance of Nationwide Children's Hospital as a whole is made up of multiple layers, starting with executive leadership at the top, then followed by medical administration and medical staff members along with departments and section chiefs. So again, this begins with the executive leadership and the medical administration, which are several members, and continues on with department and section chiefs, directors, and co-directors, as well as the division chiefs, as in the Heart Center, managers of business, clinical operations, and inpatient services. Within the effort to execute the strategic plan and uphold the mission, vision, and values of Nationwide Children's Hospital lie multiple programs, budgets, and procedures that were and continue to be put into action by senior leadership. The hospital strategic plan is set into motion over a 5-year period of time as one process builds on the previous process with compounding effects that all point toward meeting the vision of the organization. By utilizing the SWOT analysis, the organization's strengths and weaknesses are defined along with its opportunities and threats. Both an internal and external factor analysis summary were formulated from this analysis. The strategic factors analysis summary was built by analyzing the external and internal factors from previous tables and deciding which were most important and condensing these factors into the final summary matrix. Based on this analysis, strengths are seen in overall organizational mission of no child being refused care based on their ability to pay, coupled with the top ranking programs and achievements that lie within the Heart Center. However, a weakness within this medical specialty lies a growing need for arrhythmia management of adults with congenital heart defects. This subspecialty patient population consists of individuals who were born with a congenital heart defect and have now grown into adulthood, as their survival rates are incredibly higher than in previous years. There are also opportunities to increase services related to the obesity epidemic by supporting pediatric efforts with healthy weight and nutrition programs and education during early stages of life. There are 2 threats, one being that of the Affordable Care Act, which has increased the population of patients seeking health care across the nation, and the threat of the saturated market of high-level pediatric heart programs throughout the state of Ohio. There are multiple strategic alternatives available for the Heart Center to increase revenue, improve patient satisfaction, enhance quality and outreach, enhance quality and reach the organizational goal of best outcomes. Alternative strategies to be considered include those that seek expansion, stability, divestment, and/or a combination of all 3. In summary, alternatives to strengthen the existing and creating additional alliances with other healthcare organizations with collaborative efforts to share policy and procedures that are intended to strengthen programs and gain additional accreditations that in turn can increase the number of patient referrals. An alternative to extend the service line associated with adult congenital heart disease patients with implementation of an arrhythmia program to better address the needs of this patient population, incorporating a high standard of support staff onboarding for new hires, and provide continuing education and training sessions to existing employees in an effort to lengthen the retention rate of experienced staff. Also provide exit interviews that communicate deficiencies within the organization that can be utilized as a tool to reduce the staff turnover, as well as placing into practice a patient satisfaction tool to open the line of communication between practitioners and their patients in an effort to increase the quality of healthcare provided. Within the effort to execute the strategic plan and uphold the mission, vision, and values of Nationwide Children's Hospital lie multiple programs, budgets, and procedures that were and continue to be put into action by senior leadership. The strategy alternatives, the total quality management tool will be utilized within this project implementation piece as it serves to improve quality, involve employees of the organization. It is customer focused and has proven success in the strategic implementation process. The strategy alternatives previously discussed will be set into place only after careful consideration has been taken in each area that ensures the organization has kept focus on TQM principles discussed. The alliance with other organizations that currently exist will be enhanced starting in June of 2016 and the sharing of policy and procedures utilized within the Heart Center, along with providing education and training associated with those procedures. A timeline for adherence to policy changes will also be provided, as well as research into the deficiencies associated with unsuccessful accreditation attempts. The Heart Center will also begin to look at generating new alliances with other pediatric cardiology service lines in July of 2016, and to do so they will conduct research to uncover struggling entities, make contact with said entities, and begin conversations regarding collaborations. Stability of current activities and/or retrenchment are not a viable solution for the Heart Center. Hospital leadership is looking for new growth, advancement, and revenue-generating ventures that continue to support its mission and vision of best outcomes. The decision for growth with development of the adult congenital heart disease program by providing management of the arrhythmia needs for the patient population beginning in January 1, 2017, but starting in September of 2016, and at the forefront of this growth would be the hiring of an electrophysiology program manager to oversee the coordination of this project, and then to build a patient portal that would be part of the electronic medical record for patient enrollment, along with providing advanced arrhythmia training and existing staff members to enhance their knowledge of related rhythm issues. Responding to threats of the organization, as with those associated with the Affordable Care Act, would include addressing the possible shortage of healthcare workers. In an effort to maintain experienced and knowledgeable employees, methods will be put into place on January 1st of 2017, then increase the level of new hire onboarding programs and continuing education training credits available to existing employees. Also revamping the exit interview process to reduce staff. Turnover rates will be better if communication is possible with deficiencies throughout the organization that can be addressed when there are patterns. Lastly, quality improvement strategies to improve the survival of healthcare organizations. Therefore, implementation of a patient satisfaction tool to be incorporated on January 1, 2017 to open the lines of this communication between provider and patients throughout their encounters. Prior to that, a quality matrix measurement tool will also be generated to allow purposeful measurement of results for implementation efforts for the organization. There is also the implementation of the timeline here that talks about the preparation pieces from June of 2016 through the end of December, as well as the initial implementation of actual launching of the programs January 1 and commencing December 31st, 2017, with all of the processes put into place. The Heart Center at Nationwide Children's Hospital has an impressive structure for measurement, analysis, and communication of results tied to strategic planning and implementation efforts. According to the Vice President of Operations for the Heart Center, strategic implementation of methods and practices must be measurable to be considered with data against a baseline. Department managers and directors receive reports from finance and planning units that report actual volumes as it relates to strategy implementation. This particular example is a sample of a scorecard that kind of depicts 3 months after the implementation, showing the measurement goals and matrix that we would like to achieve, strengthening the alliances with a 5% increase in patient referrals from secondary and tertiary markets, as well as increased communication with potential alliances, launching the arrhythmia management program for the adult congenital heart disease population by enrolling 100 patients within the first quarter, and increasing employee retention rate and decreasing turnover by 10%, and increasing patient satisfaction by 15% within the first quarter, and then 5% to follow thereafter. Utilization of the scorecard is a great tool to align the mission and vision of the strategic implementation. It monitors the performance of units within the organization and compares these against the intended goals. The information generated from the scorecard serves as control measures for strategic analysis as heart center leadership share the results with hospital leadership. These individuals dynamically critique the supplied results in an effort to guide the ventures of the strategic planning throughout the organization as a whole, not just one area of specialty. The rewards of meeting and/or exceeding expected performance are gained in overall reputation of the organization, the accreditations achieved, and the recognition of entities such as the U.S. World News Report. All ventures seek to gain the reward of patient-centered outcomes. The ability to not only increase the lifespan of an individual, but also increase their quality of life is the ultimate reward. And that's my references. And that's all. Thank you. I will turn this over to any questions. Bethany, do you have any questions for me?
Yes, my question was, you said that you provide care regardless of the patient's ability to pay. Now, does Nationwide receive any grants from the government or reimbursement for those patients that aren't able to pay?
Absolutely. Most of those patients have received some financial counseling and assistance, and there are programs such as Molina that do provide reimbursement to a certain level. But then the balance billing, if they're not able to pay that balance billing, we do not, we pursue those bills. However, we don't not treat them for not being able to pay those co-pays per se. And then Missy, do you have a question?
Yeah, the question I had, it was a great presentation, Amy.
Thank you.
Thank you very much for that. I just had one question. You could have probably said this and I might have missed it, but on the scorecard, how does the hospital leadership share that with the staff at the hospitals?
The scorecards are shared departmentally, and those are generally within staff meetings. They take these scorecards, and anything that's deficient is then discussed for us to be able to put some initiatives into place to help boost those deficiencies into the green.
Okay. Does the hospital have like any kind of intranet or anything that they?
Yes.
Okay.
Yes, we have an intranet, and it's called Anchor. And I believe those scorecards are probably on Anchor, although I have to admit I'm not exactly sure. But they're definitely shared departmentally from managers to the subordinate staff.
Great. Thank you. Yeah, great presentation. Thank you.
Thank you. Rachel?
Yes. Good job, Amy. You did a really good job with your presentation. I loved it. But I kind of wanted to go off of Missy's question. The scorecard that you have now, is that for performance on the employees as well, or is that? Sorry, go ahead.
Yes. So in our kind of real world situations, we have patient satisfaction surveys. We also have employee satisfaction surveys, and those are part of our manager scorecard. So those would be pieces and parts that would be in addition to the initiatives that we've put into place that score the manager, score the institution, and goes as part of that overall venture to the mission, and then provides back again if we have some lower employee satisfaction scores, what can we implement to increase those.
Okay, thank you.
And Sharon.
Yes, Amy, I do have a question. Your presentation was amazing. The information that was given was unbelievable. I guess my first question to you is, do you work there and what position do you hold to have the availability of all this information?
First of all, thank you. I appreciate that. I have been an employee of the Heart Center at Nationwide Children's for almost 22 years. I began my career there as a receptionist in the cardiology clinic and have kind of worked my way through the ranks to being a clinical leader of the EKG electrophysiology area, which is everything heart rhythm related, EKG, Holter, cardiac rehab, exercise stress testing staff. So yes, I have a plethora of information at my fingertips.
Congratulations, because that was an awesome, awesome presentation.
Thank you very, very much.
That's all I have.
Okay, I think Bethany, you're next.
This is Bethany Watts, and this is my presentation for the Strategic Analysis Simulation Project. The organization that I chose to do the strategic analysis on was Keystone Urgent Care. Keystone Urgent Care is a department of Keystone Health, and Keystone Health's mission is to improve the health and quality of life of the people in the community we serve. Keystone Health is a federally qualified health center, which means that they receive grants and reimbursement from the federal government regardless of patients' ability to pay. Typically, FQHCs are located in an underserved area, and the majority of the patients that they service are either self-pay patients or Medicaid beneficiaries. Keystone Urgent Care was established in the fall of 2011, and their primary objectives are to treat all patients regardless of their ability to pay and to treat them in a timely manner. The external environment of Keystone Urgent Care is the fact that the community is a rural area that probably provides a more increased demand for this Keystone Urgent Care as larger cities have more options for urgent care and treatment. There are less options in Chambersburg, Pennsylvania. The area is also rich in agriculture. There are many orchards and farming, and that draws in a large portion of migrant workers. And the migrant workers are actually the reason that Keystone started to provide the services, because they had migrant workers coming in without having health care available to them. Another problem with the agriculture is that it's a contributing factor to increased allergies in the region. According to Chambersburg.org, last year had some of the highest allergies sufferers in the country, and it was partially due to the agriculture and also environmental issues relating to Chambersburg's location. Chambersburg is located in the center of almost half of the U.S. population in the south central portion of Pennsylvania, and that leads to it being a prime location for industry and distributors. There are large amounts of trucks getting the products to where they need to go, and that also contributes to a decreased air quality in the area. There are currently low unemployment rates in the area and a continually increase in jobs and the population. Franklin County in Pennsylvania is the fourth fastest growing county in the state, according to Fitch in 2011. The population that Keystone Urgent Care services is very diverse, and the company does face multicultural challenges. Currently, there's a large population of Hispanics. There's also a great deal of Amish and Mennonite population, as well as a growing Muslim population in the area. Some ongoing risks are the obvious threat to computer hacking. This is just a quick diagram of my SWOT analysis that was done, and I will actually go into a little bit more detail on this. Some of the strengths that Keystone Urgent Care holds is that they provide good customer service. Keystone is actually a leader of healthcare in our community. It offers many services to patients, whether it's just general treatment of the flu or upper respiratory. They do physicals, urinalysis, pre-employment, and TB tests. We see, Keystone Urgent Care sees every patient. They are not turned away, even if they aren't able to pay for services. They try to offer quick service to patients all the time, and the department is very successful. The Keystone Urgent Care Department is one of the most successful parts of Keystone. The federal grants that generally come in are passed off to other practices because Keystone Urgent Care typically profits. It's full of employees. The majority of them started with the company in 2011. And Keystone Urgent Care was the first department in Keystone to go paperless. And they also accept most insurances. Some of the weaknesses that the company faces is the fact that they have to have referrals. At times, some insurance companies require this, and it can lead to patient frustrations and unpaid bills. The providers typically work long shifts and sometimes for long stretches of time. Some providers have a questionable reputation with the patients. The waiting area is currently unaccommodating and during especially busy times. Some patients will arrive and see that the waiting area is full and then just leave. And a larger waiting area could decrease that amount of patient loss. The check-in area is not a private area currently, and a larger location or a check-in kiosk would help to provide privacy upon check-in for patients. Another weakness that Keystone Urgent Care faces is the federally qualified healthcare limitations. Sometimes there are limitations to the amount of growth in additional services that a company can add. The opportunities, currently there's an increasing patient demand, and with the increasing population, the forecast into the future is that will continue. That leads to financial opportunity within the organization. There is an opportunity also for migrant workers to decrease their gaps in care if the Keystone Urgent Care was able to offer more ancillary services. They could ensure coordinated care for the migrant workers as well as for all of the patients. If Keystone Urgent Care were to get a larger practice that could better manage the patient flow, it would definitely help with the privacy, and patients would feel more accommodated while they're waiting. They wouldn't be so crammed into a small waiting area. And the addition of ancillary services, once again, would help to just provide patient compliance. Some of the current threats is, the primary one is competition. There are 3 urgent cares within a 5-mile radius. The funding that is received through the federally qualified health center grants, that's a political issue, is a huge issue and one that's ongoing. If political funding is not passed, then jobs can be at risk. The more that is passed, then the more that the Keystone can expand. The computer speed and ability to hold information is currently a struggle within the organization. And the risk of computer hacking is something that I think the majority of healthcare workers are concerned about and currently working on. Another concern is that managed care organizations, if they pulled out a contract, it can be detrimental to our patients. We recently had an issue with Aetna Better Health wanted to pull out of the area, and that left, I believe it was 17,000 patients without insurance, and they would have to switch their insurance. And so that was a big thing that was worked out between the CEO and the Aetna Better Health Company, and they were actually able to reach an agreement to keep the patients there. And some physician care is a threat and also a potential liability. The strategy that Keystone uses is a competitive strategy with differentiation. Keystone Urgent Care can provide more service to patients than the other urgent cares in the area because they are reimbursed regardless of whether patients pay or not. So where other urgent cares would probably turn patients away or have to just take the loss, Keystone does not take the loss because they actually receive that payment. And they also set themselves aside by providing excellent customer service to patients. They use a directional strategy of horizontal growth. Keystone as a whole is consistently adding more practices and growing outward. And so to add that to Keystone Urgent Care and allow them to grow and add more services would be in line with the horizontal growth strategy. The strategic alternative is the larger practice in a better location. They can solve waiting room issues and provide patients with more privacy upon check-in through this. They can stay on pace with increasing patient demand, and it would also provide better management of patient flow. By providing more ancillary services, they can ensure coordinated patient care, decrease gaps in migrant care, and also provide an opportunity for financial increase. The implementation of this would be through gaining the approval through the board and CEO, and then use a top-down focus by empowering management with the tools and then go on to train the employees. They can find the location and focus on new services that would then be offered, and through all of this change, utilize total quality management to help employees understand the transition and the new company goals. In conclusion, some of the main weaknesses and threats were solved by implementing the strategic alternative of a new location and provision of ancillary services. Keystone Urgent Care must be forecasting future developments for patient care in order to remain a top provider in Chambersburg. Keystone Urgent Care also needs to prepare for continued growth within the community into the future. Any questions? I'm starting with Amy.
Nice presentation, Bethany. Thank you. I'm just curious about the migrant workers and their health care versus their lack of health care, and but yet you said that you still receive payment for some of those patients that are turned away from other urgent cares. I just wanted to understand that a little better.
Sure. So the migrant workers, primarily, a lot of them are illegal Hispanics in the area, and they typically come through only, during the times of harvest. And so they, the conditions that they live in is pretty amazing here, and they didn't have any access to health care really before Keystone Health was founded. So our CEO actually reached out to just start to provide services for them, and now we actually pretty much will write off the majority of that care, but that's part of the reason that we get the funding and the government grants is because we are providing services to the migrant workers. So, and then without a healthcare program like Keystone, they likely would not receive services or go to an emergency room, which we're trying to deter away from that to help save in the cost of healthcare.
Sure, that's really pretty amazing. Nice job.
Thank you. I don't know who is next. I believe, is it Missy?
Yeah, hi Bethany. That was a really good presentation. Thank you very much. The only question I had was where you talked about that you guys receive payment regardless of what the funding is. I mean, you're talking about the grants and federal funding, or can you explain that a little bit more?
I'm sorry, you were breaking up a little bit. Can you repeat the question?
Sure. You had said during the presentation about you received, or Keystone receives payment no matter what, and you said regardless of funding issues, but they're getting grants, right? And then they're getting federal funds. So I didn't know what the funding issues were.
Okay, so there could be funding issues anytime that it's very political. So anytime that there's not more funding passed for federal health cares or community health centers, then they risk they can risk losing the practice or organization. Now, like Keystone is one of the biggest, I believe, in Pennsylvania. And they have like various different practices, whether it be pediatrics, the urgent care, internal med, family medicine. So, and a lot of these practices could be self-sustaining. The Keystone Urgent Care is profitable. So without government funds, they would probably still be self-sustaining. Some of the other practices aren't as profitable. And so when government grants are given, then they are applied to the practices that need them the most. But does that kind of clarify your question?
Yes, it sure does. Thank you very much.
You're welcome. Thank you. And I believe Rachel is next.
Yes, great presentation, Bethany.
Thank
I
you.
had a question about, you said that the physician care, some of the physician care was a liability. What exactly did you mean by that?
There's just some physicians that actually right now there's only one on, but I guess the liability through all of the employees are aware of it, but he is also the medical director. And there's not been anything specific, but there are a lot of patients who come in and specifically request someone else. So it's just kind of a really tricky situation, and a potential threat, but then there's nothing that's been that's happened that could actually change that at this moment. Does that make sense?
Yeah. Thank you very much.
Okay. And is it Sharon last?
Yes, Bethany, very good presentation.
Thank you.
The question I have, you're welcome, is about the opportunities. You had mentioned something about there possibly would be a chance of putting in the check-in in with the kiosks. How do you feel about that with the HIPAA violation process?
Well, I actually think that at this point, in looking at the check-in process, a kiosk would be a better situation. Currently, when patients come to check in, they write their name on a list, and so the list specifies first name only, but patients never ever follow that, so they always put both names. And then the check-in is very close to each other, so, and there's two check-in people at the same time, so whatever information is being asked of one patient, the other patient can clearly hear. There's no divider, there's nothing that's in place to add to the privacy. So I think if there was a kiosk and someone could come in and type in their name and you could call them up like in a staggered way, it would add to privacy. Or like if there's a different location where they can have dividers between the patients, that would also help with patient privacy.
Very good. Thank you.
Thank you.
Got it. Simulation project. Oh, that's not the right one, Rachel.
Okay, I chose Excel Health for my strategic audit project. Excel Health was founded in 2004 and is a nonprofit healthcare organization. It is made up of 3 main hospitals spread throughout the area, along with 35 clinical specialties, a medical staff of 500, and over 4,700 employees. They pride themselves on seeking to make care accessible and affordable for the communities. The Excel Health Billing Department, which is what I will be focusing on throughout the strategic audit, is a crucial part of the organization. This department consists of account receivable representatives, charge entry, and coders. As a team, they all work together to make sure the dictation from all the specialty positions are coded and then built out as clean as possible to receive maximum reimbursement. The economy as we know it when it comes to the external environment in healthcare is decreasing in affordability. Because people are living so much longer, there's been an increase in chronic conditions and the pressure it puts on healthcare facilities to provide adequate care. With an increase in chronic diseases and illnesses, there comes a rise in prices, making it harder for both healthcare professionals and patients to afford treatment and services. Some of the different challenges that the billing department faces are the continuous regulatory requirements being put on the healthcare providers by CMS. These include the need to implement technologies that show that they are using the hospital information system in a meaningful way. This adds to the financial burden of the providers because if these are not met, reimbursement is reduced. CMS will also not reimburse for services if the providers can't prove that the patient had a successful outcome. They also have to deal with the competition that comes from other outside healthcare providers such as UPMC. This has been one of Excella Health's major rivalries because the patient in the area have the choice of going to Excella or UPMC. Patients think that because UPMC is located in the Pittsburgh area that they have high technology and more services than the Royal Hospitals do. There was a recent presentation given by the market department at Excella Health which stated that 47% of Westmoreland County residents are patients at Excella Health. This means that almost half of the residents living in the county are going somewhere else. The current situation at Excella comes from the financial aspect of the central billing office. The hospital billing and specialty billing are two completely separate departments. The chief officer of finance comes into the monthly meetings and gives the employees an idea as to where they stand financially and what they are bringing into the organization by how many claims are going out. The more denials that they are seeing, the more decrease in profit they are seeing as well. They need to figure out a way to increase profit and lower denials. They have been very successful over the past 10 years, but as they continue to grow their specialty offices too fast, the denials started to increase year by year. Now that they have slowed down, it's time to reflect on how they can decrease their denials and increase their profit by fixing the past mistakes and working towards how to make the future claims go out clean. The governance structure of Excella Health first begins with the Board of Trustees. The responsibility of this board is to work collaboratively together to focus on the bigger and future picture of the organization. The Central Billing Office has their own line of leadership that they have to adhere to every day when it comes to new implementations and regulations. They consist of the Director of Finance and the Director of Revenue Cycle. The financial officer is the one who reports back and forth from the Central Billing Office to the Board of Directors with questions and concerns for projects. The Director of Revenue Cycle is responsible for overseeing the day-to-day operations of the department as well as organizes the billing and collections activities of Revenue Cycle. The billing manager is responsible for leading the charge entry team when it comes to knowing the ins and outs of putting in a claim correctly. The other billing manager is responsible for leading the accounts receivable team and having exceptional knowledge when it comes to working denials, reading EOBs, and knowing what forms go with the claims that need to be sent out to insurance companies. The coding manager is responsible for leading the coders and having a substantial amount of knowledge when it comes to diagnosis codes, procedure codes, and coding guidelines. After that, they have one supervisor who is responsible for helping with new projects that need implemented into the CBO. They also have leads who are in charge of the specialty teams. The internal strengths of the billing department at Excella Health are that of their employees. A handful of employees have been with Excella Health for over 20 years now. They know the ins and outs of the system and are overwhelmingly knowledgeable when it comes to billing and working the accounts receivable. They have a customer service line that lets patients call in to ask questions about their bills or insurances. The billing department also has their own set of internal weaknesses like any organization does. One of the weaknesses includes the retention of some of their employees. They have a lot of employees that are hired on but do not stay longer than 6 months. This means the time put into training that employee is lost. Also, communication between the office staff, managers, and the employees have become a weakness over the years. The insurance regulations are always changing on a regular basis, so it is crucial for everyone in the billing office to not only know the new regulations, but to understand them as well. Also, because of so many denials, the organization had to outsource the denials to be worked on, because the billing department did not have enough employees to be able to work on these old denials. In the billing department, they have their own set of external opportunities. With new physicians coming on board, the organization is able to bring in more patients, which ultimately will bring in more profit for the whole organization. Bringing in more profit will eventually help the organization grow substantially over the next 10 years. They would like to build an outpatient rehabilitation facility and also bring in another neurology group. Bringing in more specialty physicians will also help when it comes to being competitive. One of the threats that Excella Health has is the competition from the UPMC hospitals that are located in the city outside of their county. Patients believe that the city has more advanced technology and has more to offer than the small county of Westmoreland does. The billing department also has to deal with the threats of insurance and government regulation policies. They have to make sure they are being compliant with all of them. If they are not, they could become audited and then wind up in a legal battle because of fraud. The first objective would be to find new ways to be just as competitive as the competitors themselves. The competition has been increasingly rising, especially when it comes to technology and accepting of insurances. Technology is advancing every day, and it becomes increasingly hard for healthcare providers to be able to keep up to date with the latest services available. This is where the marketing department will come into play. The second objective would be to discontinue the outsourcing. This means that they need to reduce the denials that are filtering into the system so that when the money comes in from the reimbursement, it won't have to be split between both companies. Running a report on the denials will let the billing department know the different reasons for the denials. Some of that could be because of eligibility reasons, error in demographics, or coding issues. Communication is very crucial to the department, not just with the staff in the billing department, but with the front office staff at the specialty offices as well. There needs to be new policies and procedures that are set into place to make sure that communication is happening between both parties. The first procedure that needs to be set in place is a monthly meeting between the office staff and the billing department so they can discuss any questions or concerns. When thinking of expansion in the future, we also need to consider hiring new employees for the billing department. The retention of employees is also a major factor as well. They need to create a survey to figure out why there is such a major turnover in employees in the department. Once they have enough specialty doctors ready to be on board, they can then think about constructing a complete neurology office. They could even have 2 separate offices in different locations that would be accessible for patients who live in different areas. One of the first steps that need to be taken for implementing the strategic plan is for the Director of Finance and the Director of Revenue Cycle to work together to come up with a new functional budget for the billing department. This new budget will then need to be taken to the Chief of Finance, who will take the new budget and present it to the Executive Board. The management staff and the Director of the Billing Department will also have to work collaboratively together to come up with new policies and procedures to make sure that communication becomes one of their top priorities. These will then be taken to the Human Resources Department to become approved. There needs to be set dates that are assigned every 6 months for employees at the billing office to be able to communicate in person with the office staff at the specialty offices. Also, any new regulations that are created by insurance companies need to be shared immediately with the billing staff. It will be determined by the upper management staff if the new regulations will require training or not. Some regulations are more extensive than others, so this will ultimately determine whether the employees will need to be trained. Meetings should also be held in the billing department when new regulations are made because it then gives the employees opportunities to ask questions. The Director of Revenue Cycle will be in charge of making sure that the outsourcing has stopped. There will need to be reports run to see how far behind the accounts receivable team is when it comes to denials. This will help determine when the outsourcing can come to an end because it is taking away from their profit. The marketing team will also need to become involved in the strategic plan. Because patients are more aware of their insurances and have a better understanding of how they work and what providers they are allowed to go to, they need to be informed that Excella Health accepts all the major insurances. One of the main objectives of the strategic plan was to make sure that the denials from the account receivable were diminishing by finding a way to help close the communication gap between the front office staff and the billing department employees. By doing this, it should have reduced the errors that get sent out when the claims go out. Because there have been meetings now implemented to stop the communication, the only way to be able to tell if the denials have decreased would be to run denial reports every month. In these reports, there are different categories mapped out, informing the department as to how many denials there are and why each claim has been denied. The main goal is to make sure that the denial queue is decreasing each month. If it isn't, They will need to go back to the drawing board and figure out exactly what is causing this department to have so many denials. The end result of this would be to eliminate the contract from the outsourcing company and bring back that lost profit to the rightful organization. The employee retention is also something that will need to be reported to make sure that employees are hired onto the billing department and are staying longer than they have been. A new survey will be given out to measure the satisfaction of the employees and to also keep track of the turnaround rate. Ultimately, these goals should result in a more financially stable organization overall. Okay, and this is my reference page. And does anyone have any questions? I'll start with Amy.
Very nice presentation. I always find billing and coding information incredibly interesting because I know nothing about it. So I'm curious about what type of employee that this company looks to hire, if they're having, just such a difficult time with retention. Do they, ask for people who have experience in that particular situation? I know there's been a change in ICD-9 to ICD-10, and that's a lot of, kind of knowledge base that had to be relearned for a lot of experienced people. I was just curious about who do they look for to hire?
Well, they usually look for people that definitely have experience. I know that I was actually hired from my intern from my school. I had graduated and did my internship there, and they usually hire people right out of school. I mean, they don't have exactly that experience, like from another work perspective, but they do have the schooling experience, and that gives them, especially the coders, especially because people just off the street that don't have any knowledge of coding, I mean, it takes a while for them to learn that. So they like to grab them right out of school when they already have all that knowledge. But billers, I mean, they can actually work their way up. They can just come off. I don't want to say come off the street because that sounds like they're homeless, but you know what I mean.
Yeah.
Like people that don't have experience, like it's easier for billers because they can be taught. But I mean, so can coders, but it's harder for coders. So I'd like them to come right out of school or at least have past experience.
Gotcha. Awesome. Good presentation.
Thank you. Bethany, do you have any questions?
Yes, Rachel, very good job. I enjoyed that. My question is, what do you think one of the main causes for denials are? And you may have gone over that, but I missed.
Honestly, I think the main reason for the denials is a lot of demographic issues. And I think, like I said in my presentation, there's a lot of communication issues as well because we have certain codes for the insurances when we send them out electronically. If the front office staff is not putting those insurance codes in, like specifically what they should be, it'll come back denied because electronically it doesn't understand electronically how to go out. So it's just a big communication issue.
That makes sense. Thank you.
You're welcome. Missy?
Thanks, Rachel. Yeah, it was very good. Question I have too, it kind of is around the employee satisfaction. Is there anything in place like to have the employee that's leaving for whatever reason fill out a survey or say the reasons why they're leaving? That would help with the department to look at better training and other things or communication issues or whatever.
Yes, I believe that actually when they have to have an exit interview whenever they leave, they have to, Human Resources calls them. And they did look into it one time, but then we never really heard anything about it after that. So I'm not really sure exactly if they are even trying to do anything about the turnaround rate, but we know from in our department, there's been a lot of people in and out, and it's getting ridiculous.
Yeah, we had the same issue where they do that exit interview, but then the departments never really get that data back.
Yeah, so exactly. That's exactly what it is. Like Human Resources just keeps it, and we hear nothing.
Right. Thank you very much.
You're welcome. Sharon?
Yes, Rachel, a question I have for you. I know you're talking about where UPMC is a competitor of yours, and that may be due to some part of them having better technology at their facility than what you do have. Do you know if Excella Health is planning on doing anything about that in the future?
You know what? I'm not sure with the technology. I think they are trying. I actually think they are honestly attempting to team up with them. Actually, this just was recently said, like during one of our monthly meetings, that they are actually trying to team up with them now. So instead of them actually being a competition anymore, maybe they're going to start working together and like collaborate like different services for the patients. That way, UPMC, because I know sometimes UPMC and Highmark, sometimes they don't take insurances, like certain insurances. So I think maybe this will actually work out better for the patients and they won't lose out in profit if they start working together as a team rather than enemies, you know. But
yeah, I think, well, and I think that's what it's all about too, is these organizations joining, you know, with cooperation and collaboration just to make it more efficient for the patient and cost effective, basically.
Yeah.
But thank you very much. You had a great presentation.
Well, thank you so much.
Once again, this is my strategic audit simulation project. I'm doing mine on it's Twin Valley Behavioral Healthcare, what's called TVBH. It's a civil and forensic acute care units that provide psychiatric services to adults in 15 Central Ohio counties. Basically, Twin Valley, to summarize that, is a state hospital. We're one of 6, so we are part of the Ohio Department of Mental Health and Addiction Services. The population that we serve are the severely mentally disabled adults 18 or older with or without substance use disorders. And we also have a separate building that's the maximum security unit that does forensic patients that are court ordered for competency restoration and those who are found not guilty by reason of insanity. The mission of TVBH is to promote healing in a behavioral healthcare environment built on hope, respect, and compassion. Okay, the external environment for Twin Valley is, like I said earlier, we are a part of a state agency, and we every year we're told that our budget remains the same. It doesn't go up, it doesn't go down, but it pretty much stays the same. So, and then the other part of that is we're always at 95% or higher capacity. Another issue that we are affected by is the meaningful use requirements. We also have a increased Somalia population. Actually, Columbus, Ohio is got the highest population of Somalia population in the nation. So having to deal with, how to deal with that cultural issue when we have those patients come in. We actually have everything in their language as well, a whole separate documentation. So, and we also are having increased competition, if you can say that, from private psychiatric hospitals. They've opened 2 in the Columbus area in the last couple years. And we are having issues with housing, discharging patients to some type of housing. Okay, our strength is that we do have specialty, caring for the severely mentally disabled population in Central Ohio. We do, just like you guys have referred to your strategic plans earlier, is that we take referral patients no matter if they can pay or not. We also do competency restoration for jail. We have very qualified physicians here. We have physicians that are forensic fellows. We also are a teaching hospital. So at any given time, we have nursing students from Mount Carmel, from Capital, from OSU, from Wright State, and they cycle through at different time periods depending on the college. We also have residents, psychiatric residents from Wright State and OSU as well. And we are really starting to work with telehealth services, and that I'll talk a little bit more about that later, but that has been very helpful for case management. Our weaknesses are we currently have no EHR. We have a bunch of separate clinical systems that are old. One of them has been there from the 1980s. And none of them are really integrated. They do share some demographic data, but they are really siloed applications. We do have, like I referred to earlier, we have budget constraints. So there's a lot that we would like to do, but we can't. And we have an increased problem with access to housing. Okay, opportunities. The opportunities that I see that we could really work on is to enhance. We have a lot of relationship with community providers and mental health boards. We should take advantage of that and use and start expanding our telehealth services for case management and discharge planning actually as well. As cited earlier with the meaningful use, really we need to have an implementation of electronic health record, and budget constraints up to this point is what has stopped that. And we could definitely be doing more here with the finance side, even though we don't, if a patient can't pay, we take them no matter what. But the state's attitude in the past has been not to really pursue that, not to see if there was any other avenues for revenue. Okay. Threats, no electronic health record, just like I talked about before. The increased Somalia population and the increased competition from private psych hospitals. And this is a picture of the SWOT analysis that I did. It listed what I just previously talked about. Okay. Looking at the alternative strategies, I definitely felt like the cooperative strategy, specifically the network cooperative strategy, would definitely work to move us forward. And that is to really look at the relationships that we have with the providers. They actually have quarterly meetings with them now, but they're not really sharing data with that. So an opportunity there would be to share data with the specific provider of who their clients are in the hospital, how long they've been there, if they've their readmits, within a certain time, like 30-day readmissions, that kind of stuff. Also, with the jails, enhancing that relationship actually would be great in having some of the physicians actually be at the jail and provide psychiatric services there, or APRNs. Either one of those would be really good. Telehealth services and working with the community providers and mental health boards, and actually the jails do it as well. If we could expand that for discharge planning, start working with these guys and talk about, how can we make this work better and even telemedicine. The last part of that is to form a strategic alliance because we don't have the funding to actually purchase a full electronic health record, is to form an alliance with one of the local hospitals. Well, it doesn't have to be local. It could be, other state hospitals in other states, to look at those opportunities to see if we could share in the costs of implementing those. Okay, the SWOT analysis showed the top priorities, and those are what I talked about with the enhancing the relationships with the providers and the mental health boards and the local area hospitals. Implementing the EHR is a must. It has to get done. It will affect revenue, increased revenue. It'll patient satisfaction, all those areas. It will hit upon that, and so in taking a look at that, the hospital leadership does agree that this is a good strategy and a good fit to address those needs. You can't really see that slide, but that is pretty much the implementation schedule. Getting the hospital leadership to buy into that strategy and getting a timeline in place for that. And basically, what we're talking about is starting in, we actually started this in the beginning of March, having the leadership to, look at those and identify those top priorities, and then decide on the strategy, and be done with that in the middle of March. And then to have meetings with the staff, the hospital leadership have meetings with the staff on all 3 shifts. That means coming in at 2 o'clock in the morning and getting that 3rd shift, so you can communicate what the new strategy is to the staff so they understand why we're doing what we're doing. After that is to assemble the priority teams. Would definitely be a combination of clinical and administrative staff on all three of those. And then, the leadership setting a timeline, establishing a timeline for the completion of this. So we're really talking about from the time beginning of assembling the teams, having a year in that strategic plan to have these three areas worked on. Okay. So once for evaluation and control, once these teams are assembled and they start doing their work, is to have them report quarterly to hospital leadership. And they do that. We do have quarterly meetings, and we do have the leadership report out if they're working on specific projects. So the entire leadership is there. They hear the same thing. And also, this is to have them define key metrics for each priority, and then develop a scorecard for each priority item, and then have it published on the intranet, and actually shared it in departmental meetings too. But to do it, as we all know, communication is done better if you do it multiple ways. So you do it electronically, you do it in person, because it doesn't always work. What works well for one doesn't always work well for another person. So in conclusion, having Twin Valley's hospital leadership accomplish their three goals is to implement this strategy because of budget constraints. So working on improving their relationships with their external customers and partner with them, and also, having a strategic alliance as far as getting that electronic health record in there. And won't be able to do that if we're not going to be able to move ahead as an organization if that doesn't happen. And the do more with less is now the norm, which it shouldn't be. So, and that's the end of my presentation. Any questions? Amy, I'll start with you.
That was a really good presentation, and I think the biggest question I feel like I have is, it sounds like you guys do a lot of stuff for like the jail and the forensic portion of mental health. Yes. I would think that the state kind of, or maybe it's federal, whatever, mandates everybody being on an EMR by a certain amount of time. I'm just really impressed that you guys can't get that for your facility.
Well, what it is because we don't have a lot of the meaningful use. We don't qualify for a lot of that, so we wouldn't get those incentives back. So what they're doing on the department level, the director's looking at getting grants, as well, some way to get that funding in, so we could get this. And they've already looked at different. There's one that they're looking at. It's called Avatar. I don't know if anybody's familiar with that, but that's really more of an outpatient behavioral health care EHR. Or, they're looking at that. But they've had a couple times where they've started, with this, and then had to stop because they did not have the funding for it.
That's just crazy. Very nice presentation. That's just amazing.
Yes. Thank you. Okay, Bethany.
Missy, great job. I too was amazed that you don't have EHR yet. I think that's kind of crazy, but I think that's interesting too, if it's different on the mental health side versus, the other healthcare. My question was in relation to, you said that they always tell you that the budget's the same every year, year to year. How does that happen? Like, that just doesn't even seem realistic.
Well, what it is because we're part of the state. They approve so much budget for that, for each agency, and then the agency directors doles out, so much per hospital. So, it really comes down from the governor, and then it flows downward. So
but he's not doing this. I mean, you're not allocated the same amount every year, are you, from the governor?
Close.
Doesn't that change?
Yes, it's very close every year. I am not kidding you. The
okay.
Equipment budget has been the equipment budget. I mean, oh yeah, yes.
Interesting. Well, great presentation. Thank you.
They regionalize a lot of stuff where they, regionalize services. So if you have an HR department or an IT department, they may be regionalized for Athens and Columbus. They're trying to look at all different ways to make do with what we have.
That's great. Thank you.
Okay, Rachel?
Yes, great job, Missy. I just wanted to ask, and I know everyone keeps saying about the whole EHR thing. When are you guys like attempting to try and get into EHR, or do you not have to? Because I know, like, from my organization, we actually bought up a lot of different offices because they couldn't afford to do EHR on their own.
Yeah.
So how does it work for your company?
Well, what we currently have now is we have a homegrown system that does patient registration, and it does incident reporting, and it does the pharmacy and CPOE. So I mean, literally, they've built this from the ground up. So we do, but we don't at the same time. So that's a standalone system, and then they have another system that strictly does assessments and progress notes, and it does some group scheduling for patient groups.
So it has parts of EHR, but not like the full thing.
Right.
Okay.
Right. That's exactly right. So I'm sorry I didn't clarify that, but yeah, we do have stuff, but we have a lot of paper too. We have, when they talk about our medical record, they refer to it as a hybrid. When we have Joint Commission come in, we say we have a hybrid medical record.
That's a good name for it. I like that. Thank you.
Okay, and then I think Sharon?
Hi, yes, Missy, that was a great presentation, but my slides didn't move. Did everybody else's slides move?
No, my slides did not move either, but I'm thinking it's because I uploaded it, and I think it thought that I was the presenter.
Oh.
So
I actually moved them myself as she was going through the presentation.
Oh, did you?
Yeah.
I was going to move them, but then I didn't want to. I didn't want to interrupt her.
I mess it up. Exactly.
I was able to move them too, just through the presentation.
Oh, you did? Okay.
Yes. Mm-hmm.
Good. There you go.
I just switched it over back to me. So can you see that
good.
now?
Yeah.
Yeah. Now we can see it.
Sharon, do you want me to go through it again?
Yeah. Oh, no. I followed along very well. Anyway, Missy, what I was going to ask you is, for opportunities you're mentioning about getting into telehealth and telemedicine, are they going to be implementing that soon into your organization? I mean, without having the the electronic medical records, I'm not sure.
No, that actually is implemented, and what they do now, like it basically, it is really, we have a contract with OUCOM for video conferencing, and what they've done is they have put a computer in each one of the treatment team rooms, and they strictly do it with for the treatment team meetings, but they only have a couple of the providers that are willing to do it right now. So when I talk about expanding that, it's really talking to all, especially the out of county, in county, Franklin County would be fine, but we have a lot of, like, Logan County, we have counties that are an hour away. And so we're really trying to target those guys to expand this way.
That's good. Okay.
Yes.
Yeah, very good. Thank you.
Well, thank you guys. Thank you for putting up with this.
Hi, my name is Sharon Ernst. I am doing the presentation for Upper Valley Medical Center in Troy, Ohio. It is a nonprofit. It is a not-for-profit healthcare provider committed to serving the healthcare needs of Miami County, Ohio, and the surrounding area. Upper Valley Medical Center is a hospital that's organized as a nonprofit corporation. The organization is structured in this way because nonprofit hospitals gain tax-exempt status by meeting guidelines that are set by the state and federal governments to ensure the hospitals provide benefits to their surrounding communities and other providing medical care free of charge. UVMC is a hospital that typically accepts everyone who comes to the hospital regardless of the patient's ability to pay. UVMC is there to serve community in any way they can, and by leading with care, which is part of their mission statement. And as you can see on the front cover, they are leading with care with unique, valuable, and medical care. Slide 2. As you will see, UVMC I have listed their external factors, the opportunities and threats for the organization. Technology advances is something that they're very adamant about. They like to be top-notch on all their technology, and we are now starting the beginning of telemedicine. So that is helping to be a great opportunity for us to improve on the organization's skills that they have. Another very important thing is the growing community health that we have. We didn't have a rural community, and it is growing. And the growing community health care programs are also being implemented into the organization more and more all the time. And we can do this because we have a great committed primary care physician staff that we are working with. Like everyone else, some of the threats we have is, of course, the increasing government regulations, the reduced government reimbursement, mental health, limited resources is something that we're working on to possibly do something with that and kind of or gain on that. And then the substitute of services like the clinics and home-based care. There's a lot of them in the community, surrounding communities with CVSs and stuff like this, having those available that we need to be thinking about in the future. How are we going to handle that kind of competition? And then also the increased competition from healthcare provider network, which is surrounding community hospitals with different organizations that have also starting to infiltrate our area. Next slide, please. The next slide has to do with the clinical strengths and weaknesses of UVMC. As you can see, we start this by the elements of SCAN, and produced because we determine our strengths by our value, our awareness, and our imitability and organization. Some of our strengths are the diversity. We have skilled workforce, and we have, of course, state-of-the-art medical equipment, which is our electronic medical records. We have the Epic system, which is very beneficial. We have patient portal, MyChart access. We also have great patient portal, MyChart access in our hospital. But some of the weaknesses that we're having problems with is with health education classes, being that health is moving from as continued healthcare into a proactive type of healthcare. And because of that, you're seeing some of the weaknesses showing up into providing health classes and education for our communities. And the other thing we have is some of the low staffing of weaknesses, and most probably the right staffing too, because with the all new implementation of telemedicine, joining a healthcare organization, which is Premier Health, we need to have, like I said, collaboration and cooperation between those two systems, which is something that we're working on as a weakness in ours right now. We do a lot of this analysis through scanning, analyzing, and identifying. Next slide, please. Corporate governance structure. UVMC is governed by a board of directors, management, shareholders in determining the direction and performance of the healthcare organization. The organization structure is a functional type of structure. This type of structure is when the organization is grouped into functional departments. For UVMC to operate efficiently using the functional structure, they have to have considerable coordination across all the departments. The chief executive officer and members of the top management at UVMC are responsible for the integration and coordination of the different departments. This type of structure that UVMC implements is one where none of the functional areas can actually survive without the others. They're dependent on one another. Their governing body is legally responsible for the conduct of the hospital as an institution. The medical staff is accountable to the governing body for quality care to patients at the hospital. Both hospital bodies must ensure that all patient cares provided are in accordance with orders of a practitioner who meets the medical staff criteria for the privileges granted and who is working within the scope of those granted privileges. The strategic management roles at UVMC for the board of directors is to monitor development both inside and outside of the organization. The board of directors can evaluate and influence decisions, proposals, and actions. At UVMC, they can also initiate and determine specific strategic options to its management. And then the UVMC top management members are the chief executive officer, the chief medical officer, president executive, vice president, and vice presidents of the divisions and functional areas. Along with the department chairs, there are also 3 members at large. The chief executive officer at UVMC is involved with getting things accomplished through and with others in order to meet the corporate objectives. The CEO has also the responsibility for numerous departments, service lines, accreditation, and regulatory compliance. Top management's job is they're multidimensional and is oriented towards the welfare of total organization. Next slide, please. And this is analysis of the strategic factors, some of the strengths and weaknesses and opportunities that that are facing Upper Valley Medical Center. One of their very strong points is their diversity. And as I stated before, another one would be the state-of-the-art medical equipment. And they have top technology with robotic equipment to complement their medical equipment, and are working with other organizations throughout the state of Ohio to even be able to incorporate more of the electronic medical equipment into their medical facility in order to diagnose and treat different types of medical conditions. They also, like I said, have technology advances, which is just a great opportunity where we keep growing all the time. We're getting into telemedicine. We're going to be getting into home-based care with our technology. And like I said, we have a lot of percentage of 90% of our patients are on MyChart portals, which they communicate with us through MyChart for prescriptions, for office visits, for any questions medically that they may have. And another big opportunity for Upper Valley Medical Center at this time is their growing rural communities. We're hoping to accent on this because we have a growing population. So if we can offer more proactive health type of situations into this area, I think that would be a big positive for Upper Valley Medical Center. Like I said, in order to do that, though, we're going to have to get the right staffing and increase our staffing. So healthcare education classes is one thing they're working on very urgently to hopefully promote more of this within the community at now and also in the future. Next slide, please. For implementation, the things that they would like to do, the medical field is changing quickly from volume-based to value-based care, and UVMC is implementing where they want to align the medical staff across the system through cooperation, collaboration, which is what they call like a systemness. And this is like who's going to do what, especially like with telemedicine, health clinics, what clientele, what employees are going to be taking this over. Also align and develop workforce and increase unity across Premier Health. They need the right staff and have to increase the staff in order to do the MediClinics, the telemedicine, and to expand in their technology. To improve transitions between sites of care and expand access points, they want to improve transition and how patients can access our care and improve website system for patients' convenience. They also want to develop centers of excellence with concentrated expertise and improve inpatient infrastructure efficiency. And one of these, like I stated before, was to implement more healthcare classes in the hospital or even outside in the communities. And these implementation strategies are kind of like a must-do strategy, because as everyone else, we can always do better. And turn the page, please. So for the evaluation and control, these are potential paths that UVMC are seriously considering taking, which is now to redefine, which is to different delivery care system, which is going to have to be moving probably from value-based to value-based, volume-based to value-based. And they're seriously thinking partner with a care delivery system or HAP plan, and they are implementing this with Premier Health and 3 other hospitals in the neighboring communities that they're working on to work together and become one. And they're going to, for integrating, by developing health insurance function or services across the continuum of care. UVMC has also started this just recently in the last year and a half or so, where they are self-funded and they have their own insurance company and policies, and it works towards health clinics and actually putting proactive health out there for us. Experiment with new payment and care delivery systems. I think this is something everyone's facing right now. How can we get better care and still not have the expense of providing that. For specialization, to become a high-performing and essential provider, VMC wants to be the best in the medical care for all their patients. They want to increase patient experience in hospitals by reducing infection and to reassure family members through good communications, that any questions they have about the patient's health, wherever they're always willing to go above and beyond to explain that to them. So I think the thing that we're finding here is with evaluation and control, we need to accent on a lot of the areas with UVMC, but especially with the value-based medical health care. I think that's going to be one of their top priorities. That is all. Thank you. And does anyone have any questions at this time? Amy, we'll start with you.
Very nice presentation. I picked up on a small piece, and it might just be a small piece of your presentation, but I thought it was interesting is that you said something about communication through MyChart, which we have as well where I work, but I wasn't aware that we could communicate, they could ask questions and we could respond to that. Does your MyChart work that way?
Yes, it does, Dave. It's really amazing. We have MyChart, which we call Patient Portal. They can send us email messages through MyChart, and for prescription refills, asking any kind of medical questions, schedule appointments. It's just really amazing what this can do for the patients. It keeps them active in their medical care. With this access to the Patient Portal, MyChart, they get notification of their upcoming appointments, lab tests. They can get their results online. It's through the Epic system, and it is amazing program that they have.
Awesome. Thank you very much. Yep. Nice presentation.
Thank you. You're welcome. Let's see. And then I guess we go to Bethany. Is there any questions that you have?
Yes, a great presentation. My question was, you had mentioned to develop more of the Center of Excellence. What can you expound on that a little?
Yes, I think to develop more of the Center of Excellence would be, we try our best to always do and improve in any way we can. And I think, we're always looking for new ways to improve. I think out there you see when you read all the information and literature, where healthcare is changing so much from being, value-based to value-based and being proactive, that we feel that we need to develop that excellence, get better at things that are coming up in the future, and be on top of it, top-notch.
Thank you.
You're welcome. Let's see. Missy, do you have any questions?
Yeah, I just have one. It was a very nice presentation. Thank you.
I was so nervous.
We can see yours. Yeah, mine, I don't know about that one. But when you talk about align the medical staff across the system, can you talk about that a little bit more? What that really, what does that mean?
Well, what you try to do is, what we're trying to do is align it's like where the physicians work with the referrals to specialists, how you want to work and align within your system. Like we have specialties, we have orthopedics, cardiologists, what's some of the other ones? Women's health. Those are the kind of things where when we align the medical staff across the system, we refer to one another. Like your primary care physicians, they will refer to the physicians within our system, which are specialties.
Gotcha.
No different like now like I said, we're joining with Premier Health, which is 3 other hospitals. So that even makes our alignment of medical staff across the system even larger, which is wonderful. We're working with Children's Medical Center all the time in Dayton, for specialties that Upper Valley doesn't have.
Right. Okay. Gotcha.
So it's kind of aligning with different organizations within a 50-mile radius to make our medical staff system even stronger. Is that good?
I have one more little question,
okay.
Only because I'm from Dayton.
Okay.
So, did you have Epic before you merged with Premier Health?
Yes. We
Okay.
had Epic, we started Epic in 2010.
Gotcha.
And the a physician I work with is on top of, he's very technology savvy. He takes this on as a challenge. So we are the office that tries everything first.
Oh, are you?
Yes, we
Okay.
are the pilot office. So like we just started telemedicine, and there's no one in the UVMC facility that is even doing that. But we are attempting it as a pilot program, and to see how it's going to work. And I know, like they're saying now, where for each telemedicine that we do, it's to charge $35 for the individual. They can get their care, through telemedicine, through email.
Wow, that's great.
Thank you. Yes, thank you. And let's see, I think we have Rachel.
Yes, great job, Sharon. You did such a good job. I just had a quick question. It kind of went off of Amy's question. You said about the patient portal. Now, my organization, they do have a patient portal too, which is awesome. But they also have like applications for the patients to download, like through their phone, like to get all that information as well. Do you guys have anything like that?
Yes, we have the same thing.
Wow.
They can download all of the MyChart application down onto their phone, so that they can be walking around somewhere outside, and they're going to get a message or from MyChart saying that to notify them of their appointment or whatever.
Awesome. That's awesome. Thank you, Sharon.
You're welcome.
Okay, so
Thank you, everyone. It was wonderful.